Today we have John Hellman from the Latino Commission on AIDS. He is testifying at the New York State Assembly hearing on the new prescription drug model that began October 1st. And John, what impact has this had on the members that you represent?
Well, I think one of the more important things, since this is only a 2-month-old implementation, one of the issues that we were having were that people didn't even know that this change was even happening. A number of people who we work with who are HIV positive did not receive notification, and the people who did only received it in English. We have a lot of clients who only speak Spanish and have very low competency when it comes to English. So even though they told us that they were releasing all of this information in multiple languages, many people didn't even receive it. There's a lot of anxiety for people not really knowing if they're going to be able to access the medications that actually work for them. For HIV, it's really, really important that people find very specific medications that work for them because of side effects, other chronic illnesses they might have. You know, there's a number of issues that they have to really take into account. So people are really, really worried about accessing those treatments.
Thank you. And has there been any the members of that you represent, they have not gotten medications in some cases?
Unfortunately, I haven't really heard anything specific because they have a 90-day sort of transition period where people can still access their medication. So it's too early to tell, and I haven't heard any specific stories from people whether they've had problems accessing their medication. We're really worried after in January, once the transition 90-day period is over, whether or not people are going to be able to access their medications, whether they'll even be notified or understand how to get prior authorization or any of the process. We're still unclear as to whether or not people are going to have full knowledge about that.
Okay, and what recommendations are you going to make today to the panel?
I think most importantly, the most important recommendation is to reinstate prescriber prevails language. We want to make sure that if a provider is working with the patient and they believe that there's a specific medication that works, that they have open access to that, regardless of what formulary and what drug plan they have associated.
Okay. Thank you very much.
Thank you.